Okay, great. Hi, everybody. Good afternoon. My name is Claudia Stevens. As Dan said, I'm a research associate at Case Western Reserve University's Begun Center for Violence Prevention Research and Education. We work across a variety of violence prevention research topics, but one of the main ones that I in particular have been working on within the last couple of years is supporting opioid surveillance and general data surveillance to support work on the epidemic. So today I'm hoping to kind of tackle the question of why are overdose deaths declining in Ohio with you all and share some insights from some of our work. So without further ado, let's get into it. Great. So starting off with our question here, why are overdoses declining? This is a conversation that I'm sure you're all very keyed into that's been happening for the last year and a half or so. There's a pretty large decline here happening. As you can see here, this is our projection from the beginning of the year, and we're still waiting on the finalized 2024 numbers. We had projected that drug overdose deaths in the state were going to decline at about 23% just from 2023 to 2024. Actually looks like it might be a slightly larger decline than that. And I just want to draw your attention to the trend here because we're going to see it on a lot of the other things that I go through. Is that generally we see that there was a peak at the epidemic at 2021, where you can see here that there was the most amount of deaths within the state, and that's a trend that you generally tend to see throughout a lot of the country as well. In 2022 and 23, we see sort of a smaller decline and then this very large decline that has happened from 2023 to 2024. And based on preliminary data, seems to be a trend that's continuing throughout this year. And this isn't a trend that we're just seeing in Ohio, so I want to start with that. This is a percent change in drug overdose deaths between 2023 and 2024 based on CDC drug overdose data. And as you can see here, throughout the vast majority of the country, there is a range of decreases, but an overall decrease of 25.9% throughout the entire country of drug overdose deaths. So clearly there's something happening here that's causing a general decrease. And I'm hoping to dig into that a bit more with you all. I will note that I know that there's three or four states here on the West Coast that have had a slight increase. I wish I had enough time to get into that today. Maybe we can get into questions. There are some geographical differences throughout the country of how they've been affected by the epidemic, but the traditional part of the country that has been the most impacted tends to be the East Coast and the Midwest region here with Pennsylvania, West Virginia, Ohio, and Kentucky, and we're seeing decreases in all of those areas. So going back to Ohio, I've broken out that CDC overdose data based on type of drug that was involved within the overdose deaths. And as you see here, this top line is the total cumulative all overdose deaths that we looked at in the first slide. And if you look right below it, you can see that there's a pretty clear indicator that this line is largely driven by the trends that are seen in fentanyl-related overdose deaths. There's been obviously this huge decline here that we've seen about 35% decrease from November 23 to 24 in overall deaths. And it has been largely driven by fentanyl. So we've been able to surmise here that the reason that general overdose deaths is going down is because there's a very clear tie to fentanyl-related overdose deaths going down. I'm sure that this is not surprising to many of you. Obviously, fentanyl has been the predominant driver of the epidemic for the last decade, and its lethality compared to other drugs in the illicit market obviously makes it, the main predominant drug that tends to equate to overdose deaths throughout the country. So that is the trend we're seeing here. And we basically then kind of can ask the question, why are we seeing the decrease in fentanyl-related overdoses? Which I'd like to dig into a couple aspects of trends that we've been working on to to figure out why is this happening? What are some reasons that we might be seeing fentanyl going down in the country? The first thing to consider is supply factors. Generally, changes within the drug market, the illicit drug market, are often due to supply. Uh, the cartels in Mexico, specifically the Sinaloa and Jalisco cartels, are the largest providers of fentanyl through the illicit market in the United States, but specifically the Sinaloa cartel dominates most of the market. I want to make a note that actually back in fall of 2023, it was reported that they were allegedly banning fentanyl production throughout the cartel, uh, basically under the threat of death to anybody who didn't comply. Obviously, the cartel network is so large, so complex. It's very difficult to actually enforce this, but there does seem to be some level of correlation between the time period in which a lot of these production halts came into place, and the beginning of some of the decline of fentanyl coming into the United States or being available as reflected in overdose deaths. And this is a trend that we've continued to see, and I've included some news headlines here that just clarify that, but I'll dig further into the data too. That generally we're seeing that there's less fentanyl available throughout the United States market. And that's a trend that has followed in Ohio as well. And the fentanyl that is available seems to be increasingly less potent, increasingly more diluted with adulterants, with other substances, and therefore less lethal. So seems to be causing less overdose deaths because the fentanyl that people are using is just generally not as strong as the fentanyl that used to be available in the market. And this decrease in fentanyl is something that we don't just see through news headlines or anecdotal evidence. We see it through a lot of statistical factors as well. So, for example, here I'm drawing from the DEA's NIFLS public data set, which tracks lab submissions from law enforcement drug seizures. Can be mostly reliable, but Ohio's NIFLS submissions have been very, very consistent, so it tends to be an extremely reliable measure. And that's been used and found by a lot of researchers that specifically in Ohio, tracking the law enforcement seizures through this database is a very good correlative relationship to what the actual changes in the supply and overdose deaths will be. As you can see here, we see that same 2021 epidemic peak in 2021. And then we see this smaller decrease and then a very large decrease happening from 23 to 24, specifically with fentanyl. And as I noted here, fentanyl submissions have decreased in Ohio more than 50% since 2021. And that's just considering 2024 numbers because there's a lag in getting this information, obviously, and the data being updated. But clearly, we're seeing that there's just generally seems to be a trend across a lot of statistics that fentanyl is just less available. Part of this that we've started to look into is that not only does it seem that maybe less fentanyl is being distributed or it's being diluted, but part of the reason that this might be happening is because the precursors are becoming less and less available. And to be clear, fentanyl precursors are the chemicals that are required to create fentanyl. So I'm drawing here from a Cuyahoga County medical examiner, which is one of our good partners that we work with a lot on this subject. They release a monthly report with their drug submissions. And in their latest report, they released this bump chart, which ranks the top 10 drugs that were submitted from 2021 to 2024 in Cuyahoga County specifically. I want to draw your attention to number 4 in 2021, which is labeled 4-ANPP. This is one of the most predominant precursors to fentanyl. So if you look here, it's, remaining at number 4, pretty much following the trend with fentanyl right above it. It goes up in 2023 to being the number 3 most detected drug and drug submissions. And then we see a pretty large decline here where it goes down to number 7 in 2024. So it does seem like another factor of this is that fentanyl precursors, which are largely made and transported out of China, seem to be becoming less available for a variety of policy reasons. Could be why it's unclear at this point. we can't say for sure why that's happening, but generally we can say that this is a trend that we do expect to continue to see in other areas as well. So obviously, even though supply does tend to be one of the most dictating factors of the illicit market, there's a lot of other factors that we're using to track these changes as well. Take, for example, harm reduction impact here. We're seeing a 32% decrease in naloxone doses administered by EMS and a 31% decrease projected in a emergency department suspected overdose visits from 23 to 24. A lot of this we're just expecting that this is a reflection of the fact that less people are overdosing. So less people are generally having to be responded to be revived or to be responded to in the emergency department on a greater, general basis. But obviously part of this also is that take-home naloxone distribution is becoming, more and more available. You see here between 2023 and 24 alone, distribution through Project Dawn increased 19%. It was also generally it's a very large number in the state of Ohio already. I think the 2024 number was around 300,000 take-home naloxone kits were distributed throughout the state of Ohio. So naturally, the increasing availability of this could also play into the fact that maybe less people are seeking help from EMS or going to the ED or a variety of different reasons. And finally, from the demand shift angle as well, we're seeing a pretty large shift in the market that I've, spoken to a lot of treatment providers about too. So I'm sure that many of you have seen this in your day to day, but there's an increasing movement away from using fentanyl or synthetic opioids by themselves and an increasing move towards polysubstance use with opioids, with stimulants, most notably powdered cocaine, crack cocaine, and meth. And we have some survey responses here that are helpful about kind of the increasing availability that from anecdotal evidence. This is from the Ohio Substance Abuse Monitoring Network Drug Trend Report, which provides really great insight, survey, and qualitative responses that gives great insight into changes into the drug market. It's kind of unclear at this point if that polysubstance use is intentional or if it's actually something that's desired by consumers, or is this something that's happening because people are unaware of what's in their supply? Is it because people are making up for gaps within their supply that's not available, et cetera, et cetera. But it's important to note that this generally is a trend that we're seeing. So all that being said, that's where we stand now. Um, and I want to, make a note that just because overdose deaths, and I know people on this call know this more than anything, but it's something we really want to emphasize is that just because overdose deaths are going down does not mean that it's time for us to take our foot off the gas. Um, a lot of this is about adapting to how the epidemic is changing, which is natural and it happens within every drug epidemic. So in terms of how do we now respond to make sure that we're suiting the maybe changing needs of people who are being affected, the first thing in this day and age of talking about fentanyl being more and more diluted with adulterants is that there's a need more than ever now to make sure that we can inform users to make the best decisions possible. And part of this is knowing that a lot of the substances they're getting from the illicit market, which have always been adulterated, but now more than ever seem to be adulterated by substances that are not only other major drugs, but actually might also be drugs that we've never seen used by humans before, that we have no health evidence for how it might affect them. So I draw here, again, this is from the Cuyahoga County Medical Examiner Office. They are currently doing a syringe test program through funding from the CDC, which allows them to collect syringes from syringe exchanges and also then give the results back to users if they want them, to be able to tell them the differences between expected and actual amounts that might be within the supply. So as you see here, heroin tends to be the most highly expected substance. It's actually appearing in about 20% less of the samples than it's expected. And a lot of these other substances, such as fentanyl, methamphetamine, cocaine, and xylazine, are being expected in lower amounts than they're appearing, often by a pretty large margin. I want to really draw your attention to xylazine and medetomidine here. These are two of the adulterants that have really started to dominate the market. Xylazine first appeared and has been present for more than a year now. It makes up a huge amount of the supply. It's most often found with fentanyl. Both of these substances are actually veterinary tranquilizers that seemingly started to be used as cutting agents for fentanyl. So take, for example, xylazine here. There was an expected 10% of samples that were supposed to contain it, and it was found in almost 40% of samples. Or medetomidine was expected in less than 1% and found in a quarter of the samples that have been tested in Cuyahoga County. Uh, these both of these actually used to be marked as emerging substances, but they've been moved up now to major drugs because we find them so often. And below here, you see also there's some other emerging substance threats. We see BTMPS, which is an industrial chemical that's appeared through much of the country at about 15% of samples. Protonitazine, which is another synthetic opioid, is something that started to appear in samples pretty recently, alongside benzocaine as well. So the point taking away here, there is a lot of importance and power in giving knowledge to users in what they're using and helping to guide them in how they can make the best decisions possible for themselves. And a lot of people that have been worked with through this project are very, some of them, obviously horrified by the results that they get of what they were using, but very interested in understanding the best ways that they can use their supply smartly to make sure that they're not hurting themselves. Maybe they're having symptoms that they've never experienced before. Okay, now they get a result back that they were using a drug that they've never used before. It just generally, smarter users are safer users. So want to definitely emphasize that. Um, the next thing that we want to draw your attention to is that as we're adjusting to a harm reduction market that we're aware alongside everybody else is losing a lot of resource allocation capabilities, is that while drug overdoses are declining, they're not declining at the same rate for everybody. And there's a very, very important need for us to address specific populations that are continuing to be more deeply affected by the epidemic than others. That maybe they're being missed by resources, maybe the changes in the epidemic are affecting them more, et cetera, et cetera. So here I'll draw your attention to a recent analysis that we did with death rates, overdose death rates based on race and ethnicity for Ohio residents. There is an absolutely just remarkable difference in death rates that are being experienced by the non-Hispanic Black population in Ohio as compared to non-Hispanic white populations and Hispanic populations. We see this particularly, you see here with fentanyl overdose death rates, the non-Hispanic Black population is experiencing them at about almost double the rate that non-Hispanic white and Hispanic populations are. And in terms of fentanyl and cocaine involvement together in overdose death rates, it's at almost more than three times the rate that non-Hispanic white populations are experiencing OD deaths at the moment, and more than double that the Hispanic population is experiencing them. So making sure that we're addressing populations as the epidemic is changing that are either being missed or are experiencing the impacts of the epidemic more and more acutely is absolutely essential. And staying on that topic, we've seen, continually that it's important to address users who have already experienced non-fatal overdoses and survived them, because that is an extremely strong metric for the type of users who are at the highest risk for later experiencing a fatal overdose. And you can see here we did an analysis, again, based on Cleveland, Ohio, because that's the region that we most operate in, comparing suspected illness police response data with county medical examiner overdose data. And the risk of fatal overdose for a Clevelander that has experienced at least one non-fatal overdose is 16 times higher than somebody who has not. So just emphasizing as we're adjusting to the epidemic, making sure we are allocating the best resources that we have to groups that are at the highest risk is of the utmost importance. And then finally, continuing treatment options, continuing access to treatment is, remains just absolutely important as fentanyl is going away, and maybe especially as fentanyl is becoming less available, because more and more people are going to be suffering from, very extreme withdrawal effects if they can't get access to the supply that they need, or if they're now, developing tolerances to other drugs that they necessarily didn't know that they were using. So just to draw your attention here, the state of Ohio has increasingly been able to offer services to people who are receiving medically assisted treatment from opioid use disorder. Uh, that's a trend that we would like to see to continue. Uh, that's everything that I have for you today. I'm, looking forward to engaging with questions, but also if there's anything that I can't answer off the top of my head now or you think of later, please feel free to reach out to me. And I'm always happy to talk it through.